Hi, everybody. It's Dr. Patricia Coughlin, and I wanted to talk to you today about the dangers of either or kinds of thinking, and also want to encourage you to embrace conflict and complexity. Human beings are very complex, and trying to treat the sorts of emotional disturbances that our patients have is a very complex task. And yet, what I'm seeing more and more, especially among young clinicians, is this desire for simple answers and for techniques. What do I do? Without a real deep understanding of the person that they're treating and the why you would do something in particular. I'm even seeing this kind of thinking seep into research. So I saw some research recently on ISTDP comparing treatments that included challenge to defenses versus those who did not. And, they were randomly assigned and they either did challenge or not. This actually makes no sense if you think about it and if you understand, again, the complexity of the people we're treating. Challenge is only required when you have a patient with highly syntonic defenses who see clearly that they're defending against feelings in a way that's hurting them, and that those defenses are creating a resistance in the treatment, which is going to undermine success and keep them suffering. Davenlu said no more than 20% of our patients are in that category. So only 20% or less would ever require challenge. And he also said that premature and unnecessary challenge was one of the biggest mistakes he saw in folks learning ISTDP. So you're only going to use challenge when it's required. So to say, I do it or I don't do it based on your own preferences, again, doesn't make sense. You have to be able to assess your patient thoroughly and accurately in order to know what to do when and why you're doing it. The other thing that's come up recently in discussions is whether to focus on both the conscious and unconscious benefits of symptoms and defenses, or, again, this either or thinking, or focus on the cost to the patient. We must always do both. Symptoms and defenses, right, always have some value. There's always some benefit to the patient, again, whether that's conscious or not. Human beings are always trying to adapt, albeit imperfectly. And many of the adaptations that patients have made were developed very early in their life and worked at that time and were necessary, right, but have long outlived their usefulness. So if you just hammer away at the cost, right? Look at how terribly you treat yourself and isn't this awful and so on. And you're not in any way recognizing the attempt at adaptation and the benefit. The person is often going to feel misunderstood. There's also this other camp, and I'm not in any way an expert on IFS, internal family systems, but from what I understand, they focus almost exclusively on the benefits, often unconscious benefits of symptoms and suffering. So again, because ISTDP is a conflict model, and if you think about it, human beings are designed for conflict. We have 3 brains in our head. We've got a reptilian brain, which is vicious. I mean, reptiles eat their young, okay? They have no attachment system, all right? So we have a reptile, right, inside of us. I mean, we can see this. People shooting people who are coming down their driveway. I mean, they're absolutely reptilian. And then you have the mammalian brain, the limbic system, right, which is all about emotion and attachment and so on. So right there you can see how those two parts of the brain are going to conflict. And then the newest part of our brain, which is the neocortex, right, the seat of the self, being able to think about self and other, the rational brain, right? So all these three aspects are going to be conflicting, right? So there's no way around that. And again, you don't want to just side with one aspect, right? But to understand the conflicts that people are having, right? That their defenses have benefits as well as costs. Okay, so again, this is all just a warning to you, right, to steer away from this kind of polarized either or thinking and to embrace complexity. And this also means, right, that you're going to have a deep understanding of human beings and their functioning. This focus, I mean, again, I'm going to sound like a cranky old lady, and maybe I am, but it just seems to me that people are wanting to learn techniques without understanding deeply the human organism in all its complexity. And so if you don't have a deep understanding of theory of normal and pathological development, then you're just going to be implementing strategies and techniques without that understanding. You know, it's like having a surgeon, right, who just trains on how to, suture and slice and so on, but has no understanding of the circulatory and respiratory systems. I mean, you can see that that makes no sense, and he's going to get into big trouble, right? And the same thing is true with therapists. They're getting into big trouble because they're just instituting techniques, what they think they're supposed to do, without a deep understanding of human beings in general, but also of this very specific individual in front of them, and how to really assess the nature, history, and severity of their problem, as well as their various capacities. So I am doing a webinar on May 1st, specifically focused on gaining this information in the trial therapy and adding it up into a very specific case formulation so that you really know why you're doing what you're doing, and you're choosing very specific, to focus on certain aspects. So for example, I'm thinking of a patient who had extremely dystonic defenses. I mean, he hated his defenses and was really resisting them and wanting them gone, and had no understanding of the benefits that they were serving, and they were quite tenacious. So there clearly were some unconscious benefits. And so in that case, we really had to look into that. I mean, he already didn't like these defenses and was turned against them, and yet they weren't moving. So that's where you have to think, well, what's missing here, and what do I need to do? So I want to encourage you, again, to read theory, to read research, and to really deepen your knowledge base so that you know why you're doing what you're doing with each particular patient. Thanks. Bye-bye.